Hi there, I'm Dr. Annika. So, to my knowledge, you have very probable radiation exposure from today's disaster. Is that correct? Okay. So, I have already paged oncology regarding this, and they're on standby. Just in case anything. I've also obviously paged a radiation specialist. So we already got your blood work. It's running right now. As soon as it is ran, I have my computer right here. I will see the numbers immediately. We'll go from there, see what the data says. Right now, I'm going to be assessing your vital signs, taking a look, doing a little physical examination, and then after we do that, I'm going to get a history from you and ask you some questions. Then after that, we will look a little review based on a history that you give me, your exposure, the vital signs and physical signs today, and what the data says from your blood work. We'll see what all of that tells us. We'll work on a treatment plan, see what we can do for you, okay? So first I'm going to start with a few vital signs. First, I'm going to take your temperature, if you can say off for me. Okay, 1, 2, 3, ah. Perfect. Okay, let me just type that in. Okay, make a note of that. Okay. You do have a fever. It is a moderate one at 101.12. So you are running a little bit of a temperature. I'm just gonna put in an order for broad spectrum antibiotic, just in case. We'll see if we need that or not, but just to have that order in. Okay. So next up, I am going to get a heart rate from you. Okay. Heart rate is looking good, sitting at 70 even. Perfect. Okay. I'm gonna get a blood pressure. If you can just give me your left arm. Perfect. Okay. Breathe in and breathe out. Okay. We're at 120/80. Blood pressure looks good. Perfect. Okay. So I'm going to feel for your respiratory rate. Okay, your respiratory rate is mildly increased at 95, but I'm assuming that you're anxious, everything about what's going on, so we're just gonna start there. Your circulation is a little bit concerning. Your pulse ox was mildly low. Respiratory rate mildly increased. Airways clear. You're running a mild fever. Pulse looks great. Blood pressure looks great. So I'm gonna be assessing your consciousness now. So I need to assess your orientation. Can you tell me your name? Okay, perfect. And the date. Okay. And what time is it currently? Okay, perfect. To me, you seem alert, very conscious. Rate of 5 out of 5, so it's great. Your VAR score is great. So we're waiting for your blood work results to come in right now. So I'm just going to begin assessing you for acute radiation syndrome. I'm going to be asking you about your exposure history, just to assess the severity of the radiation exposure that you had. As you're aware, you are currently being held in isolation. This is just because we don't know how severe The case you have, we did remove your outer clothing. You had to shower and new clothing. That is just because the way radiation works. We don't know how much radiation exposure, background radiation, any of that. We don't know how much is being held in your belongings, on your skin, everything like that, your hair. So I do apologize for how scary this may seem, but we're just doing our best to help protect you and everyone around you. I do have protective gear on as well, and yeah, so may I ask where you were working? Okay. And how close to the reactor were you? Okay. For how long? Okay. Indoors or outdoors? Okay. And were you wearing any PPE at the time? Protective equipment? That would be things such as any kind of lead gloves, a lead apron, mask. No? Okay. And at the time of the incident, or any time after, did you notice a metallic taste in your mouth or recall seeing a flash of light? Okay. So, can you tell me a little bit about your symptoms? When did you start feeling unwell? About how long after the incident would you say? Okay. And any vomiting? Okay. How soon after was that? Okay. Are you experiencing nausea right now? Okay. Any diarrhea, stomach pain? Okay. Headache, dizziness? Okay. Eyes burning, itching? Okay. Have you experienced since the exposure, during or since, any confusion, issues concentrating? No? Okay. Any weakness, like when you're walking, anything like that? No? Okay. Tiredness? Any pain in your mouth or throat? Okay. So I'm gonna do another quick assessing your skin. I'm just gonna look for any blisters, burns, signs of hair loss or swelling. Okay. Okay, we have a 3mm laceration, right thorax. Okay. Okay. Can you say off for me? Open your mouth big and wide. Okay. And I'm about to shine a light in your eyes. Okay. Does this cause any pain looking at this light? Okay. And I want you to follow this with your eyes, okay? Okay. Alright. So it looks like your blood results came in. Oncology is creating a treatment plan for you. I'm just gonna talk it over with you a little bit, give you my thoughts. So obviously you're admitted. We're gonna be keeping you in isolation. We're going to be running some repeated blood counts on you. We're just gonna be watching primarily your white blood count level and just make sure that they remain stable. So yeah, you're interested in your results. Okay. So your red blood cell count indicates that you are experiencing mild anemia. The platelet levels indicate that you are experiencing internal bleeding. And your white blood cell levels are very, very high, which means that you're fighting possibly finding some sort of infection in your body based on the fever. We are going to be putting you, first of all, on IV fluids just to help stabilize you. We're going to be putting some broad spectrum antibiotics in there. We're going to be watching your temperature, all your vital signs to make sure that we have that infection taken care of. We're also going to be running a chromosome analysis on you as well. We did run a urine and feces radiation testing on you. We have not got the results back. They should be in tomorrow morning. However, I did want to run a skin dosimetry test on you, which I'll be doing in a minute after we just chat about our treatment plan. So you're going to be doing IV fluids with those broad spectrum antibiotics. I'm also going to be putting some anti-nausea medication in there as well for you, since you're experiencing nausea, and some pain medicine as well to help with your pain. We're going to be monitoring your electrolytes throughout the night, and possibly needing some bone marrow support as well. How familiar are you with that? Okay. Yes, so we're just going to be monitoring and assessing you for possible bone marrow failing. This can happen from radiation exposure, yes. So we're going to be giving you some growth factors. They help to stimulate your bone cells to help stabilize your bone marrow and reduce any damage to it. You may need a bone marrow transfusion. We don't know yet. But it's looking like you in my opinion, you most likely will need a bone marrow transfusion within the next 2 hours. And may possibly need a bone marrow transplant as well. Yes. We're gonna do the best we can to support you. I do not have a prognosis as of now. Oncology will have a lot more information and resources for you, but I am just the ICU doctor. I have never been in situations such as this. This Chernobyl disaster has really shaken this hospital. I am so sorry. You are in the best hands as possible. We're going to do everything we can to support you, and we just have to keep watching, waiting, seeing what happens. Yes, so I also did assess that you had some mouth ulcers and sore throat, which are more indicators that your bone marrow may be failing. We call these signs aplasia, which means your bone marrow is being suppressed. So if you don't mind, you may hear a loud beeping noise. We will see. But we are going to be running a skin dosimetry test on you. So this is a nuclear reaction detector, and we're just gonna look at your skin and see what this tells us, and this data may help. Okay, so I'm just gonna hold this up. Can you hold up your arm for me? Okay, and I'm just going to scan your body. Okay, can you hold up your hand for me? Okay. Okay, and one more time. Okay. All right. Yeah, so the numbers are in. I cannot say because we do not have your chromosome analysis yet, or the results from your urine and feces test. But from what we see, I do suspect that you are suffering from alplasia, bone marrow suppression, and I think that I'm just gonna go ahead and order your bone marrow transfusion. You should be getting that in approximately 75 minutes, it says, and I'm gonna put you on the waiting list for a bone marrow transplant as soon as we have a donor lined up for you. If it's still looking like you are suffering from alplasia, depending on, we'll see from there. Okay. Well, I am so sorry that you're dealing with this, and I really hope to see you on the right path to recovery. So just get a lot of rest and rest assured that we are doing the most that we can for you.